All right. Testing, 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 testing. Let's see. We have nobody yet. We're telling your followers that you started a live. It's 8 o'clock. Hey, one person joined. Let me wave at that person. Wave at this person. Wave at this person. And we're starting to get some people. Let's keep waving at people and saying hi. And then we need to get our guests going. Where is our guest? Let's send a request. Hey, Dr. T's in the building. Let's give a wave to her. She's still driving home. Be safe. Be safe.
Hi.
And there's our amazing guest, Ashley. How are you doing today, my friend?
I'm doing great. It feels nice to sit inside a dental chair and not have to do any dental work. So I'm doing amazing.
Perfect. Well, I'm glad that you're actually here in office. So literally chairside. Thank you for being my very first guest. I think this is going to be an amazing series, and there's no better person to start off with than you, right?
Yes. Thank
All
you.
right. Perfect. So I love your smile. I can see those beautiful teeth. Ashley, can you tell everybody that's joining our live now a little bit about yourself and how we got connected?
Well, you and I, we met at Florida State. We were both a part of a pre-med academy, MAPS, the Multicultural Association of Pre-Med Students. And I remember you were one of the mentors there, and I was one of the freshman students coming in. So we connected through a pre-health organization at
Right.
Florida.
So go Nose. So let it be known. Go Nose. I remember it like it was yesterday. You were super bright, very attentive, and one of those people that you just kind of want to connect with. And back then we were pre-health, so we were kind of going anyway. We could have been pre-med, pre-vet. Eventually I ended up going pre-dental because of a great program called SMDEP. That's something I can go in a little more detail about later. But amazing program, basically changed my life and got me on the road. So with you, Ashley, I didn't know this until I became a dentist. You have a little bit of a dental anxiety. Tell me a little bit about that before you met the Golden Dentist.
Definitely. For me, it started when I was in elementary school, actually. One day I went outside, I was running, playing, broke my two front teeth. So in kindergarten, I had to get my front two teeth repaired, and that was a big traumatic thing because, you're young, you really don't understand what's going on, and all I kept thinking is that I'll have a missing, two front teeth my whole life. So after having to get dental work, like in an emergency situation, that kind of scared me from, any type of dental treatment. So, and then of course, because I did not want dental treatment, I don't think we had dental insurance growing up, honestly. I know we only went whenever we had like, issues. So I
Right.
wasn't comfortable going to a dentist. And by the time I started going to a dentist, I had, as I told you, an entire rap sheet of issues that were going wrong.
Right. And I remember the first day you actually showed up to my office. It had to be like 2017, and you warned me. You were like, look, I'm coming to you because you're my friend. But what you might see inside here is going to scare you. And it wasn't that bad, but you gave me that warning. And I remember us talking about the different things that you needed. And I think for me, you can tell me if I'm wrong, what I think helped start your treatment was the fact that we wanted to go piece by piece. What do you think?
Oh, definitely.
This,
Because I've always had a long list of things I need to do, as I call it, my rap sheet. That I had this long list of dental work where I needed a root canal here, a fill in here, and all I kept thinking was time, pain, and money. So I was
right.
like, there's no way that I can potentially get all of these things done. And I remember going to your office. I actually started off at the office on Sunrise or in the
Hmm.
east side. So I remember
Yes.
going to your office and you actually took the list, you did another assessment on your own, and then you broke the list down. And you're like, okay, Ashley, we're going to hold your hand, but first we'll do this, then we'll do the right side, then we'll do the front. So I was like, okay, I can do three parts.
Right. If you don't mind me saying, you remember that extraction we talked about and that we did?
Oh, no.
So I got to share this one. So It was
Fine.
one of the first things that we did was an extraction of a root tip that you knew needed to come out, but you never wanted to touch it, and it was tiny. It was about this big.
It was not that big. It was it was about this big. It was a really big root. Like it was a larger root than normal, right?
Right, if you say so. So we took out the root tip, and literally, you were like an NBA player. You were out 4 to 6 weeks after we took out that small root tip, and I kept calling you, checking on you, making sure you were taking your meds. And honestly, at that point, I thought I lost you as a patient, even though it was a little root tip, and I knew you were fine. But I had to keep checking on you because not only were you, a friend, but now you are a patient. So I have to make sure my patients are happy. So you want to tell me how you recovered from that situation?
Well, just to clarify, it was a very big root tip. I think it was larger than the normal than the average root. So this is just from my dental knowledge, which isn't extensive at all. But still, it was for me again. I was afraid of dental work, so just having that extraction to me was like the end of the world. And I thought it was infected. Remember, I kept looking up different things. I thought I had a dry socket. What's it called? I know I
Yeah.
looked up everything. So I was 100% positive that everything. Someone's laughing. They said a very big root tip. That's true. Like, look it up. There's bigger. But anyway, so for me, that was like a good introduction to you as my dentist because you were already my friend. But now for you being my dentist, the fact that you checked on me whenever I had questions or concerns, I can call the office. Somebody will help me. Even though my concerns are kind of like, irrational and not true, you still listen to them. And you still showed me like, okay, Ashley, if you did have a dry socket, this is what would happen. Okay, Ashley, you're not taking your pain medication, so maybe you're going to be in pain. So even though like from the, as a friend, now you can laugh and joke with me, but in the moment you were there like as a dentist to help guide me and show me like, you're okay, you're fine, and this is just a normal procedure.
Exactly. So you would say those type of things are what helped you get over your dental fear, or what other things have helped you kind of, rationalize and get over said dental fear?
Well, coming into the office for me made a big difference too. Because when you think about the dentist, you think about sitting in a chair, like just being cold, alone, waiting timelessly, and just like, being afraid. But when I came into your office, you had music playing. So I'm like, okay, like I like it here. And then also the wait time wasn't long. And that stood out for me because I have anxiety, very bad anxiety. So if I'm just sitting there waiting for 30 minutes to see a
Mm.
dentist, I'll probably go home because I'm going to start like thinking of the worst case scenario, like, oh my goodness, what if all my teeth fall out? Like I'll think about
Right.
crazy things. So for you, it's the fact that the way you're laughing because you know it's true, but
Yes.
it's because the wait time was very short. The office staff in the front was very friendly and like, hey, you're here. They're expecting you. And then the music here is always amazing. So you feel like you're, driving somewhere in the car, going out. You feel like you're at happy hour, but really, you're at the dentist.
But you're at the dentist and getting your cleaning.
Right.
So every time you come to the office, my staff members, they enjoy seeing you and they look forward to seeing you. I remember the last time you were here, you actually came right after my birthday, and you end up bringing us some ice cream cakes, and so that pushed you right up as patient number one for them. I know they destroyed that. But everybody brushed afterwards, and it was a great ordeal. So we loved it. So we're gonna move on now. So Ashley, can you tell us a little bit about what you do for a living?
Well, I'm a registered dietitian. So I work in the community setting and I help community members eat healthier with foods from their culture. So I have a nonprofit Eat Well Exchange, and that's our primary focus.
Awesome. And then when you think about what you do as a dietitian, how does that connect with dentistry?
It's a huge connection because when it comes to our dental health, if we neglect our dental health, it can lead to heart conditions. And also, if you have a condition like diabetes or any type of, if you have diabetes, then sometimes your wounds don't heal quicker. So if you're having dental surgery, it's important to know that it may take longer for your wounds to heal. In
Yes,
my
something I like to actually tell my patients, if you have diabetes, it's like a cycle. So the diabetes makes the gum disease worse, and then the gum disease makes the diabetes worse. So it's working back and forth. A lot of
Right.
people really think about the mouth body connection, because honestly, the mouth is the gateway to your body.
Mm-hmm.
So when we're holding off on, say, our cleanings or taking care of infections and, little broken root tips, it's very important to get that out, because we want to get that bacteria out of our body and ensure that it's not going through our bloodstream and also causing other problems, like you said, heart disease, even stroke. That's a issue that can happen. So the mouth body is really big.
Right. And also for me in the community setting, if I'm counseling someone on different foods that they should eat and I'm telling them to eat all these different vegetables and to eat, different food items, and then they're not complying, it could be because they're having dental pain. I've been there. When your teeth are hurting, it's certain foods you're going to avoid. Like one of the foods for me, honestly, I still don't eat out of a habit. I will never bite into an apple ever because I always felt like, don't judge me. I always felt like with my front two teeth being replaced in kindergarten, I always thought that if I bit into an apple, my teeth would come out. So think about that. For someone like me, there's certain fruits that I may not eat because I'm
Mhm.
afraid of those things that don't really exist. But whatever, So
Right.
also when you're talking to a client about, their dental history or about, their food choices, the foods they eat are also related to how they feel about their mouth and, the type of pain that they may be in as well.
Perfect. And for a lot of people, they don't know these things. And I see we have a couple of interesting people on the live with us. I'm going to ask Ashley a couple of more questions, guys. But if you have any questions that you want to ask myself or Ashley, feel free to put those questions in the comment section. Anything from dentistry to, the dietitian questions, we'll be happy to answer those. So, Ashley, what made you get into this particular field?
Well, for me, both of my parents had diabetes. And, it linked to other health issues. It changed their quality of life.
Hmm.
So when I went off to college at Florida State, I started to, learn more about nutrition and learn how what we're eating and how we're living our lives affect our overall health. Because for me growing up, my parents had diabetes, my grandma had diabetes. So I just thought, okay, once you hit 50 years old, you get diabetes. There you go. But
Mm,
I actually learned that it's, your lifestyle. So if I change the way I eat, if I change the way I'm living, I can actually prevent medical conditions. So that's what gravitated, me towards the field of nutrition because I was like, ooh, I can actually change what I'm doing. And also I like food. So I like to learn about food and how our body can use food, to benefit us.
I love the series of posts that you have going on right now, showing us the different cultural foods. For me, growing up in South Florida, um, we had a lot of Cuban food. So when I saw the Cuban food with the plantains, that's one of my favorite posts.
Yes. Thank you. And that's because growing up, you never learn about the benefits of your foods or a lot of the foods we eat. Like we just eat them because they taste good, but
Hmm.
really those have a lot of benefits. So that's why with Eat Well Exchange. So anybody on here, if you're not following us yet, follow us and you can check out those posts and even post some of your cultural foods and we'll share it as well.
Definitely. All right, Ash. So I know everyone's starting to get tired and going to have to log off soon. So I'm going to ask you one more thing and then we'll take some questions from the crowd. Ashley, what motivates you?
What motivates me is just knowing that there's that there's more out there, that life is bigger than me. So for me, I always feel like there's always more I can do. There's always more people I can reach. There's always, more places that my business can grow. Just knowing that there's always room for growth.
Awesome. Awesome. All right. Cartier, do we have any questions from the crowd?
Mm-hmm.
What, Cardi? Yeah, one job, guys.
Oh, someone asked about my crowns in kindergarten if I had to get them replaced when I got older. And this is also the same person that said I had a nice smile. So thank you. But yes, I did. I got my crowns replaced when I was in college. I got one of them replaced because it fell out. So that was still a pretty long time to have them. But when Dr. Golden met me, my teeth were like, it was discolored. So the top of my teeth was like a stained yellow.
Mm-hmm.
The bottom was like the crown. So it was obvious that I had a crown, and that's why I never smiled at all. Like, I
Yeah.
didn't know how. I literally just learned how to smile with my teeth last year. And they taught me here. So thank you guys. Yes, so I did not know how to smile with my teeth at all, because remember, if I broke my teeth in kindergarten, from kindergarten until adulthood, I'm not smiling with my mouth. Like, I'm
Yeah.
smiling like this.
Exactly. So it took me maybe a year. Every time Ashley would post a picture of herself, she'd take a nice selfie, but she wouldn't smile. And all of a sudden, an eyeball or a comment will pop up under her picture. And I'm like, Ashley, you have new teeth. You can smile. Show the world those teeth. Show them off. It's a beautiful smile. Everyone loves to see you smile. And again, we're so happy to have you as a patient.
Thank
Cardi,
you.
have anything for me? Cardi's sleep, guys.
Oh, someone said, do you do whitening? Yes, they do
Yes,
whitening here. And
we
it's
do white.
free.
Yeah, pain free. So with our whitening, we do Zoom whitening. Our Zoom whitening is amazing. You have same day results. If you check on my page, you'll see some of our pictures. Um, and we might be doing a Zoom white party. I'm just going to hint that for anybody in here. So if you're thinking about whitening, be on the lookout for that. Regular price for whitening is $2.99, which is super affordable. Regular price for the whitening is about $5.49, but we can definitely get you in and take care of that. We love doing whitening. We love to see the before and afters and see everyone walking out smiling. All right,
You do a
so
little white kit too to take home, right?
all right, so we have one question. How would you envision the future of medicine and how dentistry and dietitians can collaborate together? What do you think the collaboration future would be like, Ashley?
Um, I would feel like it should be more a part of both of our practices. Like, when you see a dietitian, we should find a way to incorporate, have you seen a dentist? Because I always ask my clients, do you follow up with a dentist? And they always say yes, but I don't know how accurate that may be.
You
So
have to
I would
bring
like
over to
for,
us.
right, for me as a dietitian to refer more to a dentist and to know more, to be more knowledgeable about, dental health and the signs and symptoms to watch out for, to say, hey, if you feel this, if you're thinking this, maybe you should talk to a dentist. So.
Right. Okay, that great answer, Ashley. Another question we have: do we have specialists in the office, and do I need to go somewhere else for a root canal? We actually have an endodontist, a periodontist, and an oral surgeon here at our office. That means everything that you need is under one roof, so you don't need to go meet another front desk or get a referral from me. My team's always happy to help, and we have these specialists coming into our office at least twice a month, if not more. If you have more questions, just give us a call, 954-648-2414, and we'll definitely be able to help you out.
Yeah,
All
I
right.
think I got 4 root canals here.
Hey, easy. But did it hurt? Here's the question.
No,
Did it
and that's
hurt?
the thing. They have to realize, like, if anybody was here from the beginning, you would know that I don't, I wouldn't lie to you. If it hurts, it hurts. And he can even tell you I probably limped out of here twice, like, for a cleaning. Like, I'm, not dramatic, but I'm very expressive. So I will tell you the truth, and they don't hurt. And I was actually very surprised by my first root canal, because I remember I blocked off like the whole week. Didn't I take off time from work? Didn't I do something dramatic like that?
Yeah, and I told you didn't have to, but you just did it, and you're just sitting at home bored and was wondering, okay, I think I should go back to work, Dr. Golden.
Yes. So it's not a bad experience at all. So if you
Yeah,
need the root canals, get them done, because
get
it's
them
not
done. It's not that bad. We another question. How flexible are you guys with scheduling? They get off work late and they want a cleaning as soon as possible. We're actually open late. Today is one of our late days. We opened at 10 a.m. Today and we close at 7. We have 2 late days, Tuesday and Wednesday, and we're also open up on Saturdays. Saturday appointments are very prime spots. So if you're going to take a Saturday appointment, please make sure you show up because you're taking an appointment away from somebody else. that really needs it. So yeah, we love our Saturday appointments, and we're able to help a lot of people. All right. Cartier is fired today, guys. I'm literally firing him on Instagram Live. He's supposed to be reading these questions. Someone asked, "Do you
A crown? Do you
go
do
for?"
same day crowns, or do you wait for the crown to come back from the lab? Call Cartier. I'll take
Yes, we do.
it over.
Yes, we do same day crowns. We have a CEREC machine. So the advertisement says that we'll do the crown in under 2 hours. But when Cartier's not falling asleep at the wheel, we can actually do the crown in about an hour and a half. And then with Leia, I can probably do it in an hour. So, and also Kendall and Krista. Those two are really fast. Cartier, this guy. All right. So, Ashley, we're going to go ahead and get ready to wrap this up. I'm going to ask one last question. This is one of the surprise questions. Here we go. What is the best advice you've ever received?
He doesn't deserve this.
You said, what is the best advice I ever received?
Yes.
Well, it's actually something my sister says a lot. She always says you're not an island. And that applies to, so many different dynamics. When it comes to you starting a business, you're not an island, meaning you don't have to do things by yourself. If you need help, there's always people there willing to assist you. Yes. When it comes to, your dental health, you're not an island. So if you're feeling pain, you can call West Sunrise Dentistry, and somebody here is going to help you out. But you know what I mean? Like, honestly, the statement, you're not an island, just means that you don't have to go through things alone if you don't want to. There's always people that are willing and able to help you around you if you just leverage your resources. And also if you make those connections. So
I think that is a beautiful answer. I feel the same way. No one should be an island. With my team, I can do anything with them. Even though I give Cartier a hard time, he knows that I appreciate him and I depend on him a lot. I ask a lot of him because I know that he can deliver, and I also make sure I give back to them. So we, as a community, we can do more together. So I'm going to go ahead and end it there, Ash. I truly appreciate it.
I have a question for you.
Oh, go for it.
What made you start your Monday playlist? That's my favorite thing. Like, I look forward to that every week. So what made you start that?
I absolutely love music. Krista thinks it was her that helped me start that, but no, I'm always mixing music. My wife will tell you I'm listening to music nonstop, and it keeps me going. It literally is what motivates me. I can't work in silence. I actually get on my team every time the music stops. I need them to go ahead and turn it back on. And if I'm out with friends, I always grab the aux and I want to kind of play the music. In my mind, I'm a little bit of a DJ. I want to be a DJ. Thank you. I enjoy it. See how songs come together and then watch everyone's response to the song. So again, I love doing my playlist. The next one's actually going to come out for February. I don't know if it's going to be February 1st or February 3rd. I already have the songs out. I've already kind of played it from my office. They got a sneak peek. But I'm super excited to release the next one. And you guys are going to love the cover art for this one. I think this one's pretty good as well. So that's what gets me going.
And I hope you saw in the comment section, a lot of people are saying DJ Golden. So you might have to go ahead and hold that name down on Instagram too.
I have to. I was walking out today and she was like, oh, Dr. Golden needs to go ahead and publish his mixtape. I'm like, ma'am, it's on Apple Music. It's on Spotify. Links in the bio. You will have 10 volumes plus the ones for 2021. So we're out here giving them life with the music. So if you guys have requests, please send them over to me so I can go ahead and mix it up. All right. So we're going to go ahead and end it there. Thank you so much, Ash. Thank you, everyone, for tuning in. If you have any other additional questions, please DM me. And yes, the mixtape will be dropping soon. I see you guys. We'll make it. I'm going to do February 1st now. February 1st for the people. All right.
Do it for the people.
Thank you guys so much. Have a good night.
All right. Bye.